From the Toronto Star, I'm Adrian Chung, and this matters. You already know about the Delta variant, that it's more transmissible and driving the fourth wave into the fall. To protect yourself, is it time for a COVID vaccine booster? Canada has one of the highest vaccination rates in the world. More than 65% of the population has had 2 doses. But that good fortune still leads to big questions. How long does immunity last for? And how do the vaccines react to the variants? The ethics of boosters are tricky to figure out too. Dr. Mike Ryan leads the WHO's infectious diseases emergency team, and he describes booster shots in high-income nations like this.
If we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets, while we're leaving other people to drown without a single life jacket. That's the reality.
On This Matters, we're joined by Kenyon Wallace, investigative reporter for the Toronto Star, who has the latest details about booster shots in Canada, who's getting them, why they're being released to some people, and when the rest of the public might be getting theirs. Kenyon, always good to talk to you. Thanks for joining.
Nice to be here, Adrian. Thanks for having me.
Let's begin with the basics of booster shots, not just for COVID, but in general. What is the science and the thinking behind booster shots?
Well, they're meant to ensure that any immunity that you have developed through initial shots is essentially boosted. So, obviously we've all gone to the doctors, or at least most of us have, I would assume, to get our booster shots over the years for things like hepatitis, or you can get your yearly flu shot. In terms of COVID, what we know is still actually quite preliminary, but in Ontario and BC, what we've seen, they're just 2 provinces in Canada that have begun to give booster shots, is we're targeting those who are most vulnerable in terms of their health. So say, for example, immunocompromised people, such as transplant recipients, those undergoing blood cancer treatments, people on immune modulating medication, and also we're targeting those who live in senior congregate settings like long-term care homes, which of course were devastated throughout the first 2 waves of the pandemic, and as well as high-risk retirement homes. But they are the groups that are currently being targeted in Ontario, and we have not heard anything more about anybody else who would receive booster shots.
So to be clear, there is no widespread booster shots going on. Anybody who's listening, they're not missing out on anything unless you are somebody who has a severely compromised immune system, essentially.
That is correct. Yeah, no, there is no mandate or instruction or recommendation as of yet to give booster shots to the general public. As I said, the select groups that have been targeted in Ontario over the last few weeks are those who have serious health problems or are immunocompromised, or those who live in high-risk congregate care settings. But everybody else who's received 2 doses as of now, that's all you get.
You mentioned Ontario and BC are 2 provinces that have begun a booster shot program. But what does the federal government or its advisory council, NACI, what do they have to say about booster shots at this stage?
Actually, not a lot. I spoke to the Public Health Agency of Canada, and they have said basically that as of now, fully vaccinated people, including older adults, have very good protection against severe disease and death from all of the variants of concerns as of now. And they have not issued any kind of statement as to whether or not boosters are needed. They did say that immunocompromised individuals may require an additional dose to produce, say, like a comparable immune response to someone who's healthy and has had 2 shots in the general population. But that is it. They have not made any recommendations about boosters for anybody. They are meeting in the coming weeks to discuss any kind of recommendations they may come up with. We don't know, obviously, what they're going to say, but it is on their radar. But as of yet, it's been the provinces who have basically been going it alone and saying, we're going to start immunizing with 3rd doses these very vulnerable populations.
I mean, there are many variables here, but the one big variable that I think a lot of people are wondering about is, of course, the Delta variant. We know that is more transmissible. At this stage, what do we know about how that plays into the research on booster shots?
We've had some preliminary research out of Israel, which of course began to vaccinate their population very early on in the pandemic and surged ahead of most nations initially. There's some preliminary data there that shows that the effectiveness of Pfizer in particular against severe illness in people who are old, so older, so 65 years and older, who say were vaccinated earlier this year, say January or February, they are indicating that there is a slight reduction in effectiveness of this particular vaccine in older individuals. However, there is not very much research, if any, showing any kind of serious reduction in effectiveness in, say, healthy younger individuals who've been fully vaccinated. So again, this goes back to what Nasi was saying, which is that, as of now, if you are a healthy individual who has had 2 shots, you should be well protected, even from Delta. So apart from that research from Israel and a few smaller studies that the CDC is looking at, there's not a lot saying that boosters would be needed in younger cohorts.
Right. So at this point, the science is not settled. We are still gathering data on it. And you also spoke to some medical experts, like infectious disease expert Dr. Isaac Bogosh, who sort of raised a flag, much in the same way, about how this affects fully vaccinated people. That if you're a healthy person, that if you are fully vaccinated, he has some questions he feels needs to be answered before we go down that path.
That's right. So like Dr. Bogoch, who is an infectious disease specialist at UHN and also a member of the Vaccine Distribution Task Force here in Ontario, he is also of the opinion that it is not medically necessary to get a 3rd dose if you are a healthy individual who has already received 2 doses. And he did raise some concerns about the very rare but serious condition that can arise concerning inflammation of the heart, myocarditis, which is, again, a very rare condition. It's the inflammation of the heart, and it has shown up predominantly in younger cohorts, predominantly but not exclusively in men, and predominantly but not exclusively after a 2nd dose of the vaccine. And his point was that, we know that these younger individuals have very good immune responses to the vaccine. If you've had 2 shots, your odds of being hospitalized and dying are very low. And so the question is, if your protection is already really good and your chance of getting sick is very, very low, and your chance of being hospitalized is even lower, why give a 3rd dose where you might be adding potential risk, of this condition known as myocarditis? So his point was that, we need to think about this and what's the benefit of that. And I should make clear that Dr. Bogoch is, he is very pro-vaccine, obviously, that his job is to get as many people vaccinated as he possibly can. But he raises that point that if the research says that, you're generally all right as of now anyway with 2 shots, why do another shot when we don't actually know potentially what the risks could be?
Right. We might be adding more complications until we know more about this, until there's more data that's gathered around the world, much like, the initial vaccine testing and rollout.
Exactly. So, if you're like, say, a healthy 20-year-old who has a very strong immune system, who's shown a great immune response to your 2 COVID vaccines, and you're fully vaccinated, then there really is no need for you to get a 3rd one, at least not right now.
We'll be right back. Canada is not alone in starting to hand out booster shots. France, Germany, the UK, they all have plans in the works. And I wanted to look more specifically at Israel, one country that you had already mentioned, and the US. Those are 2 nations that have been talking a lot about a booster shot program. From where we stand, what do we know about their thinking on that front? I know that, their decisions don't always affect ours, but do we know their motivations and their thinking behind that?
Yeah, so as I mentioned earlier, Israel has done some research into the effectiveness of COVID-19 vaccines, and their preliminary research has indicated that in older individuals, the effectiveness of the Pfizer vaccine may be reduced over time, especially if it's been, say, 8 or 9 months since your last shot, your 2nd shot, basically. So what they have decided to do is initially they began to offer booster shots to everyone aged 60 and over. And as of now, the program has been expanded to people over 30. Now, the US, which is obviously very close with Israel, has been looking at what's been happening there, and it has caused them to basically rethink their position on booster shots. And actually, President Joe Biden last week, was waxing lyrical about how it's important that people in the US get their booster shots. And of course, what happened was, the White House press secretary later had to come back and say that while the president was saying that he wants to get people, vaccinated with their third dose 5 months after their second dose, the guideline from the CDC is actually 8 months. So we're not there yet.
Hold your horses.
Exactly.
We're not quite there yet. Yep.
Correct. And actually this week, which is the last week of August, the Centers for Disease Control has been meeting to look at this very issue. Do we recommend that US citizens get a third dose? And essentially what I've been able to glean from it is that there is discussion about potentially giving third doses, much like we've been doing here in Ontario, which is to really target those who are vulnerable and those who work with vulnerable people. So like healthcare workers and vulnerable groups who have, say, immunocompromised diseases or who are immunocompromised, I should say. But again, there doesn't seem to be any kind of impending recommendation that the general population get booster shots in the United States.
Thinking about the people who need it most, this makes me think on an international scale. I think about COVAX, which we've covered on This Matters before. That's the program from the WHO that is working to secure vaccine doses for billions of people around the world that have not even had their first COVID vaccine dose yet. These are often low-income nations. That is part of the reality of this thing, is that we're talking about it on a global scale. And when I talk about that, can you explain why booster shots, even from an ethical standpoint? It's actually pretty controversial right now, right? Especially for high-income nations like Canada, like the US. Can you explain the thinking behind that?
Yeah, I mean, it is a very controversial question, and it's an ethical minefield because with the Delta variant, which is highly transmissible, is our obligation to ensure that our own populations are fully immune to it, or should we also be, looking to those nations that have had very low vaccine doses available to them? And it's a question that has gone all the way to the WHO and has actually the Director General, Tedros Ghebreyesus. He's calling for a moratorium. He said this earlier this month. He wants a moratorium on very rich nations giving out third doses until at least the end of September, so that 10% of the population of every country in the world can be fully vaccinated.
We cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
Because there are nations where it is a completely different story than it is here. And I can give you some examples. So, for example, there's 3.5 billion people on Earth, which is about, almost half of the population that have not yet even had a first dose. In the continent of Africa, 2% of the entire population there has received a single dose. 2%. So meanwhile, Canada is at like over 70%, and rich nations are about the same. There are continents and countries in this world that are nowhere near this. And so we've got an abundance of vaccines here to the point where we're giving away third doses, albeit to those who have health problems. But, should we not be turning our attention to areas where there is vast under-vaccination? Because the argument, I guess, is that if you still have huge swaths of the population that are not vaccinated, that doesn't do much to help prevent the catastrophic consequences of what we're seeing here, because there's opportunity for new variants to form. There's high death and crippled healthcare systems in the countries that don't have this, whereas even one dose can help to alleviate that. While here in Canada, where most people have got it, we're not at risk at the moment of seeing our entire nation collapse or our entire healthcare system collapse, because we do have pretty high rates of vaccination, comparatively speaking. So should we not be putting some of this effort to those nations that are seeing severe outcomes because they don't have enough vaccines?
Yeah, the ethical question then is, should somebody get a third helping of a vaccine when, again, there are billions of people who have not had their first? And, that vaccine dose, how is it better used? And I think some would argue that the person who has no vaccines should probably get their first rather than a person should get their third. That's one level of thinking, yeah.
That's exactly right. And, the rich nations have secured huge shipments of the current and future doses, while lower income nations have not and will end up waiting because of that. And so it's lucrative for the pharmaceutical industry to have buyers like first world nations that have a lot of money to spend. But then you've got people who are going to die because they don't have access to the vaccine. So, I think it is quite clear that we do need to figure out strategies to get more vaccines to lower income nations and to make the spread of the supply much more equitable, to bring down the overall infection count, death count, and to prevent nations from having severe problems with their healthcare systems that, they may not be able to weather as well as, say, a first world country or a rich country.
Kenyon, I'm aware that everything we're talking about in this conversation could change a lot over the next few months. We are in the fourth wave. We will likely learn a lot more research and have more data about booster shots. But it's so interesting, this conversation, because almost like everything else in the pandemic, when we talk about booster shots, it almost seems like this Venn diagram of medical advice and public health. And then we're also talking about ethics. It's a complicated thing to talk about.
It sure is. As if the science wasn't hard enough, now that we've got these vaccines, getting them to the people who need it most is another problem. It's another challenge. So it's something that the WHO is very concerned about. And it's something I think that a lot of people in first world nations or more wealthy nations would also agree is an issue that we need to address.
Kenyon, thank you so much for this. I'll talk to you soon.
Thanks, Adrian.
And that is Kenyon Wallace, investigative reporter for the Toronto Star. That's it for today. Thanks so much for listening. I'm your host, Adrian Chung. Our This Matters team is me, Adrian Chung, Brian Bradley, JP Fozo, Matt Hearn, Morgan Bachnick, Raju Mudar, Saba Aitazaz, and Sean Pattinen. Our music is by So Called, Mike DeAngelis, and Sean Pattinen. We want to hear what stories matter to you. Please send us your comments, questions, or ideas to thismatters@thestar.ca. Please consider supporting the journalism the Toronto Star newsroom does at thestar.com/subscribingmatters. And don't forget to subscribe to This Matters on Apple Podcasts, Spotify, or wherever you listen to your favorite podcasts. Let's talk soon.